Hi, everybody. On today's Two on Your Side Town Hall, tough questions for Catholic Health. I sat down with the head of the hospital system to talk about some of the issues with a potential strike now just hours away. Plus, how SUNY is trying to deal with a pretty startling drop in enrollment over the next decade, only worsened since the pandemic. And how stamps are suddenly becoming a hot issue in the Buffalo mayoral race. We're going to be talking about that and a lot more with a reporter who is covering Byron Brown and India Walton as we're just about a month from the election. On this Thursday, we've been covering the labor dispute between nurses and other healthcare workers at South Buffalo Mercy Hospital and Catholic Health. We've heard from union representatives throughout the process. Well, earlier today, we got the chance to sit down with the president and CEO of Catholic Health to talk about the differences between the two sides and these last-minute negotiations that are literally continuing at this very moment. Here now, an extended part of that conversation. As we go through some of the sticking points, there are a few of them, just starting with salaries. It does seem like there's been some movement there in what Catholic Health has been willing to provide in another contract.
As of last night, we're pleased to report that we provided an economic proposal worth $36 million to the union late last night. And that is within the total budget for the economic package for this contract of $250 million. In that, Michael, we've covered fair and competitive wages, we've covered benefits, we've covered some other items that were important to the union and the associates they represent. So we're very pleased with what we put on the table, and we're looking forward to hearing back.
I guess in terms of the salary conversation, what the union has said is when you factor in increased health costs, that they would actually be making less money. Does this help alleviate that or shrink that difference?
Yes, we've adjusted. What we've done in the proposal last night is we've taken that into consideration. So we're giving that we gave the union a contract that took that into consideration. And how they want to counter that proposal, if you will, is really up to them. But we listened to them about health insurance, other benefits, competitive wages, and staffing and recruitment, which I'm sure we'll get into in a couple of minutes.
Yeah, it seems like staffing really is one of the big sticking points right now. The union is pushing for ratios in the contract. Why is that not something Catholic Health can do?
Catholic Health manages with what are called staffing grids. All hospitals do that based on daily census. So I'm pleased to report last night, we've actually committed in our proposal I mentioned to have an increase. We would have a 10% increase over the average daily census of staffing, which will enable us to adjust based on the census, which gets after that need that they had related to if there was a staffing shortage or if there was someone out on leave or things like that, or a fluctuation in census. But I think the most important point, Michael, is if you were to Google right now, healthcare staffing shortages, it wouldn't just pop up Catholic Health. It's a national challenge. It's where do we find it, make sure they're competent, and make sure that we're balancing the staffing grids or the staff to patient grids to provide patient care. And that's what we're doing every day.
What is Catholic Health doing in terms of going out and finding those workers and recruiting those workers that you need to improve those ratios?
Right, so since January of 2021, we've hired over 1,200 new associates, and north of 200 of them have been RNs. The challenge we're having now, in a recent piece in national publications, many nurses are now moving to what are called traveling nursing positions, where they're leaving their communities and they're going to work for a national firm in different states where they can make their salary for a year in 2 months. So what we're doing is we have over 7 recruiters nationally contracted out. We have a director of talent acquisition and retention at Catholic Health that 24/7 focuses on that. To take it a step further, Michael, that person actually went to the bargaining table for over an hour and sat with the union to hear their concerns, identify solutions so we could work together on this long-term problem.
Before I ask you about the contingency plans, because clearly you have to do that, right? How optimistic are you that in these final hours that the two sides can come to an agreement, or at least come to an agreement to allow more time to continue negotiating?
Both sides want to have a deal. Both sides have gotten into healthcare because they care about the patients, they care about the community. A strike puts a wedge between what I just said. I have no question that the CWA, as I said, I tip my hat to them, and Catholic Health want a deal. The point is what is it going to take to do that? And we believe the proposal we have on the table now addresses the concerns we heard, and we're willing to work with them until we have a deal. And there's many people out there that say it would be a disaster if there's a strike, and that's the last thing we want at Catholic Health, and I believe it's the last thing the union wants as well.
You still have to prepare for a disaster scenario, right? What has that preparation been like, and are there outside workers at hotels in Western New York right now ready to service the hospital should the strike happen?
Yes, so whenever there is negotiations, you don't necessarily have to deploy the resources to be ready for a strike. What constituted the deployment was being handed a 10-day strike notice. So with that means that in 10 days the union can strike. So we needed to engage in the multiple phases and installments of payments to this organization because it's unknown if CWA was going to take its members out on strike. So that wheel has started moving. So yes, there are workers in Western New York being prepared, being oriented to Catholic health facilities. It's not something we wanted to do. We were disappointed we had to do it. We'd much rather take those dollars and put them into a package that we were working on, but we need to protect the community. We need to focus on that while we're trying to get to the point of a deal, which will happen tonight, we hope.
I think people kind of wonder when an outside worker comes in, how familiar are they with that place?
Well, the most important thing is how familiar are they with the patient they're caring for. So you have all the technology in the world, and unless you can take care of a patient, go in a room and take care of them with your team, that's the most important part. Most of the workers coming in are familiar with the technology. We have also volunteers that have stepped up from the community to come in and help as well. But there is a challenge. I don't want to mislead you and say that it won't be any different. The best workers to be at Mercy are the workers that the CWA are representing. They're outstanding caregivers. Our goal is to have them remain there. Our goal is to avoid a strike, but we have to plan. So we have done everything we can. We've been at the table. We have a great proposal on the table that addresses staffing, addresses wages, addresses benefits, and that's kind of what we're focusing on and hopeful, because those are the best caregivers, are the ones that are currently working there today.
All right, so we also talked with the union today that represents those workers who may walk off the job at 6 o'clock tomorrow morning. Our Dave McKinley has their response to this new contract offer from last night from Catholic Health. That's coming up next on Channel 2 News at 6. A lot of the issues that we've dealt with throughout the pandemic weren't necessarily caused by it. They were there already, just made worse by COVID-19, and that seems to be the case with a troubling trend hitting schools across the SUNY system right now. The Niagara Gazette reports that data shared at the SUNY Board of Trustees meeting this week shows that there were more than 375,000 students at SUNY colleges right now. That's down almost 5% from a year ago and down almost 20% from 2011. It's a remarkable drop, and one we asked the Gazette's Albany reporter Joe Mahoney about today.
Well, we've seen a big plunge in the enrollment for in public schools from K through 12, of course, over the same period. Actually, that goes back further. So you have fewer young people coming up of college age because enrollment is down all across the state, especially in rural counties. People have moved out of upstate New York, rural areas left and right, and they haven't been replaced by other folks. And overall, the state has lost 1.6 million people through out-migration. So this is all contributing to the challenges and the problems at SUNY that they have to come up with a solution for.
And this isn't just a New York State problem. Pennsylvania's public university system just this summer approved a plan to merge schools so that its 14 universities will be cut down to 10. Mahoney thinks that could also happen with SUNY.
So whether or not SUNY is going to decide to do something like that, it may not. It's really not up to SUNY, because I think any institution, there's a natural tendency to try to preserve the way things are, keep the status quo going. So ultimately, I think we're going to have to see the governor and the legislature look at this, study it, find out what is happening. Is it possible to even turn this around, leaving all these campuses open as they are, or do they need to kind of right-size this entire system? Does SUNY need to be right-sized? And how much is it costing to keep open campuses that are not attracting the number of students that used to go there?
Yeah, we'll see how it plays out. He also pointed out that this decline isn't affecting all SUNY schools equally. He says the numbers show the big research institutions like University of Buffalo have shown only very small declines, while smaller schools like Buff State have seen sharper drops.